in this episode.
What are the different criterias that make a mirror an ideal mirror for intraoral photography? Let us have a look. This primarily happens because one reflection is actually happening from the coating surface and the other reflection is happening from the thickness of the mirror. So you will get two reflections. I prefer the sides of the full arch occlusal mirrors to be convex because they will help me get extra amount of retraction of the buccal mucosa. I have seen a lot of clinicians using the mirror the wrong way. The ideal technique to use the mirror is to keep the mirror. Now let's talk about how to maintain your mirrors. How do we counter mirror fogging? This is also a very important question. You're listening to the Dental Photography School podcast, where I'll be sharing practical tips on clinical and general photography. I'm Dr. Mayur Davda, and I've been coaching dentists and dermatologists on clinical photography since 2013. If you don't want to miss out on any action, make sure to subscribe to my show because I release an episode every Saturday morning. Why do we have to use intraoral mirrors for photography? The answer to that is extremely simple. If we want good pictures, we need to try and be as frontal or as perpendicular to our subject as possible. Now, with the limited space that's available inside the patient's mouth, it's difficult to get that kind of an angulation. So, the only way out is to use an intraoral mirror for documentation purposes. Sometimes the region that we want to document is very distal, and the approach to that subject is very, very difficult to obtain. Even in certain cases like these, we have to use an intraoral mirror. So, what are the different criterias that make a mirror an ideal mirror for intraoral photography? Let us have a look. Any mirror that you want to put inside the patient's mouth obviously has to be autoclavable. That's the primary criteria. The mirror has to be rigid so that it does not flex, because flexing can cause distortion. The mirror should be very thick so that apart from getting a good reflection, you should be able to do a little bit of retraction or achieve a little bit more of mouth opening. That's a primary requirement as well. For that to happen, you need to have the mirror which is contra angle and not straight. So just keep these criteria in mind before you invest on mirror equipment. The ultimate criteria for a good mirror, however, is that your mirror has to be front surface coated and not behind surface coated. That is because if your mirror is behind surface coated, apart from the actual reflection that you're going to get of your subject, you will also get a halo of your subject, which is also called as a ghost image. This primarily happens because one reflection is actually happening from the coating surface and the other reflection is happening from the thickness of the mirror. So you will get two reflections, and it actually looks like blurring happening in place. This is why for any kind of documentation, we use front surface coated mirrors. In fact, if you're a clinician, I'm sure you understand the importance of front surface coated mouth mirrors as well. So these are the primary criteria. Now let us look at some secondary criteria. If your mirror has a coating of zirconia or chromium, it's said that those mirrors are good. This is primarily because the reflectivity of zirconia coated, chromium coated, or sometimes even titanium coated mirrors is extremely high. But the drawback of this is that whenever a mirror surface is coated, the mirror becomes extremely expensive. If it fits your budget, you can go ahead with coated mirrors. But I prefer stainless steel mirrors. The stainless steel mirrors that I prefer to use are extremely rigid. It's approximately a thickness of 1.2 millimeters. That's a very, very good thickness because I can put a lot of pressure to achieve that extra mouth opening from the patient side. My stainless steel mirrors are Contra angled mirrors and they are not straight mirrors. So it helps me achieve a good amount of angulation that I actually want, which you cannot actually attain with straight mirrors. Another reason why I prefer stainless steel mirrors is that whenever you're doing dentistry with a rubber dam, you have to stretch the rubber dam, and it becomes very difficult if your rubber dam sheet thickness is extremely thick because you have to apply a lot of force. And whenever you use a glass mirror for that, there's always a worry that the glass mirror might break. Stainless steel mirrors, on the other hand, they help us give a good amount of force because we are not really scared if the mirror is going to fall apart. Whenever you invest on mirrors, don't just keep on investing on one design. You need to have different design of the mirrors. For example, if you want a full arch occlusal image, use the big mirrors, the broad mirrors. They're also called as full arch occlusal mirrors. I prefer the sides of the full arch occlusal mirrors to be convex because they will help me get extra amount of retraction of the buccal mucosa as compared to the concave sides, which does not help me with any kind of retraction, although they might be a little easier to place. But I prefer convex side surfaces as compared to concave side surfaces of the mirror, concave sides of the mirror. One more thing that I would probably want to emphasize on is how to use the mirrors. If your mirror is contra-angled, the side that we use for documentation is the convex side and not the concave side. Just keep that in mind because this is a very, very important point. Now let's talk about the placement of the mirror. I have seen a lot of clinicians using the mirror the wrong way. The ideal technique to use the mirror is to keep the mirror as away from your subject as possible. If I give you an example, if I want to record the full arch maxillary occlusal image, see to it that the distal end of your mirror does not touch the maxillary molars. In fact, the distal edge of the mirror has to rest on the mandibular molars. For example, 3.6 or 3.7 or 4.6 or 4.7. Another thing that you need to understand is the angulation of the lens to your mirror has to be as perpendicular as possible. Getting an exact perpendicularity that's 90 degrees angulation, I believe is pretty difficult unless and until the patient has a very good mouth opening or you're recording the premolar region, which is a little easier to record. But if you're recording the molar region, it becomes a little difficult, especially the 7s and the 8s, to get perfect perpendicularity. So a little bit of 70 to 80 degrees angulation is also enough, but see to it that it does not become an acute angulation. Otherwise, you'll end up getting a little bit of distortion, in the sense there'll be a mesiodistal angulation in your pictures. How do we counter mirror fogging? This is also a very important question, and this problem is faced very frequently, especially in cities which are hot and humid. So there are different ways to counter fogging that happens of the mirror. One of the ways is to use a 3-way syringe and use the blow of air and prevent fogging to take place. The other way is to dip the mirror inside a bowl of water which is warm and then use it inside the patient's mouth. But I personally prefer not to use this technique because the water keeps on dripping and maybe you will not realize it visually when you record a picture, but you will definitely realize a little bit of blurring or small droplets of water when you look at the image on a big screen. So try and avoid this particular technique. I personally prefer a technique which is called as using dry heat. So I have something called as dry heating bags, and they are frequently available with physiotherapists. They are just used as something to give a heat pack on any part of your body. So what I do is, before using the mirror inside the patient's mouth, obviously my mirrors are pouched in a sterilization pouch. What we do is we heat the heating bag and we place the pouch of the mirror on the heating bag. Now once the mirror is warm or hot, we remove it, and then we remove the seal of the pouch, and then we use it inside the patient's mouth. Just keep in mind that you have to inform the patient that the mirror might be slightly warm so that your patient does not get startled. But the technique that I use the most is just asking the patient to keep the mouth open for at least 40 seconds before you actually put the mirror inside the patient's mouth. This 40 seconds to 1 minute will give an opportunity for the moisture to evaporate. See to it that the patient does not close the mouth at this particular time. I like to record images very quickly. So whenever I put mirror inside the patient's mouth, I just request the patient to stop breathing for 2 to 3 seconds, and that would be it. So if you follow the workflow properly, you just require not more than 5 seconds to record a particular image, and it's very comfortable for the patient to keep and it's very comfortable for the patient to not breathe for 5 seconds. But this is not a good technique if you're a beginner, because you might take a very long time and the patient cannot hold his or her breath for a very long time. If you're using a rubber dam, that's the best way to avoid fogging, obviously, because there's going to be no humidity that's going to come out from the patient's mouth onto a mirror. Now coming to the last part, there are a lot of mirrors which have an inbuilt fan in them to prevent fogging. As much as I would have loved to use these particular mirrors, I wouldn't like to use them because they require to get charged. That's an additional workload for me. And the second reason obviously is that they are very heavy as compared to the normal mirrors, and they are very expensive, probably 8 to 10 times the cost of a normal stainless steel mirror. So it's one of the reasons why I do not prefer to use, although so-called hi-fi mirrors, I don't like to use them. The other reason is obviously they are straight mirrors. They also have an inbuilt LED in them so that it's easy for you to visualize inside the patient's mouth whenever you put these mirror inside the patient's mouth. So ultimately, the choice is yours if you want to use stainless steel mirrors, glass mirrors, or high-end mirrors with a fan and an LED light, which are really very expensive. But if you think it's value for money, go ahead and buy it. It's completely fine to use those mirrors as well. Now let's talk about how to maintain your mirrors. If you are using stainless steel mirrors, you do not have to worry. You can just go ahead and autoclave the stainless steel mirrors. But if you are using glass mirrors, I would suggest that you actually ask the manufacturer if they are autoclavable. If you've done a documentation inside the patient's mouth, I would suggest that you should not scrub the mirror with any kind of a cloth or even a gauze piece or even tissue papers for cleaning it. This is one of the reasons why whenever we sell mirrors to any client, we provide something called as a microfiber cloth, which is an extremely soft cloth. This is the cloth that you can use for cleaning the surface of the mirrors if there's a splatter of blood or saliva. But after you finish documenting a case, you do not need this particular cloth. You can actually go ahead and you can clean the mirror with liquid soap and water and just wash it with your gloved hands. You do not need any kind of a scrub for scrubbing the mirrors, because anyways it's going to go for autoclaving. Whenever you wish to sterilize or autoclave your mirror, you're going to be pouching them, but there's one important thing that you need to do before you start packing your mirrors into pouches. That is, cover your mirrors with a soft facial wipe, a soft tissue paper. Why do we do that is because after you finish autoclaving and whenever the mirrors are cooling down, there has to be a little bit of condensation of water that's going to take place. If this water gets condensed on the mirror directly, there will be spots on the mirror which will be very difficult to remove. Sometimes it's even permanent. So the best way to maintain your mirrors is whenever you finish documentation, do not scrub the mirrors with any kind of a scrub. Just wash them with liquid soap and in running water. After you finish drying them, wrap them in a soft facial wipe, and then you can go ahead and pack them into sterilization pouches. You can autoclave them and just use it the next time the patient comes back. The last tip that I would want to suggest is don't keep only one set of mirrors for your documentation. You should have at least 3 to 4 sets of mirrors depending upon how heavy your OPD is or how many patients you see during the day. I typically keep at least 10 mirror sets, contraster sets, and cheek retractor sets in my private operatory, because obviously you have to use one set of mirror for one patient only. So you have to use only autoclave sets inside the patient's mouth if possible for you. So keep at least 3 to 4 sets of mirrors. Maybe you can keep on autoclaving them on a cyclic basis. There is one particular mirror that I absolutely love, and that is the Quadrant mirror by the Magic Box, that's by the Dental Photography School. The beauty of this mirror is that most of the people do not understand that the dentists document quadrants most of the time. So most of the mirrors are very broad. But the Quadrant mirror or the sectional mirror by Magic Box, that's Dental Photography School, is a very slender and a long mirror. That is because it's very easy for the patient to accept these slender mirrors inside their mouth as compared to the full arch occlusal mirrors. I always tell my students, try to use a smaller mirror inside the patient's mouth, as small as possible, but it should be getting your work done. In the sense, it should be narrow enough or small enough, but the mirror edges should not be seen whenever you're documenting your cases. In fact, I hate to see mirror edges, and this is one of the reasons why I do not suggest my course participants or delegates to use mouth mirrors for documenting their cases, which I've seen a lot of endodontists use. It's not a good idea to use intraoral mouth mirrors for documenting your cases. Even if you are recording a single tooth, do not use mouth mirrors for documenting your cases. Please use a long, slender mirror like the sectional mirror by the Magic Box. The other end of the sectional mirror is also a periodontal mirror, which is useful to record the lingual flaps or the buccal flaps for the patient. This sectional mirror is also useful to record intraoral lesions. So if you're a dermatologist and you want to record intraoral pictures of lesions, but that particular lesion is quite distal, you need to have one of these mirrors because it's a very, very helpful mirror. So try to record a mirror image if you're not getting a good direct shot. Hopefully this session would be helpful for you to make the right choice of mirrors for your intraoral photography and documentation. That's all we have time for in this episode. If you are getting benefited from my tips, do show your love by leaving a rating and a review. For tutorials on photography, do check out my channel Dental Photography School on YouTube. To participate in contests and live events, join the Dental Photography School Facebook and Telegram group. You can follow me on Instagram as Mayur_EOS Maestro or Dental Photography School. I'll meet you next week. Till then, keep listening, keep sharing.